If you're looking to sell your practice, you might be wondering, how long does it actually take? The short answer, it's about a year. The longer answer, it depends on your practice, your buyer, and how much assistance you're willing to provide after the sale. Hi everyone, it's Alexei from Nechai Appraisals. I like to break down the practice transition into two phases. Phase 1 is the sale itself, from the day that we start marketing the practice until the deal closes. Phase 2 is transition assistance. That's when the seller stays on and works in the practice after the deal closes to help the buyer take over operations. Let's start with the first phase. Selling a medical practice isn't like selling a house or even other small businesses. In most states, medical practices have to be owned by licensed physicians. That narrows down the pool of potential buyers quite a bit. Typically, the first 6 to 9 months are spent marketing the practice, qualifying buyers, and negotiating offers. Once there's an accepted offer, it takes another 2 to 4 months to close the deal. That's your due diligence, credentialing, financing, lease, contract negotiations, and all the other moving parts. So it takes about 9 to 12 months to close the deal if everything goes smoothly. Once the deal closes, we move into the second phase, transition assistance. In many practices, patients come to see a particular provider. So if you sell your practice and you leave the next day, that could be very disruptive to the practice, especially a solo practice. For that reason, most buyers require a transition period as part of the deal. Without it, the practice might be unsellable or it would sell at a substantial discount. The length of the transition depends mainly on two factors: the type of the practice and the type of buyer. Take a solo cash-only plastic surgery practice. Patients likely choose that particular surgeon for their reputation and their skill. So in order for them to transfer that reputation to someone else, the seller would likely have to work side by side with the buyer for many months after the deal closes. Another factor that determines the transition length is who is buying the practice. If the buyer is another physician who is planning to work in the practice, the transition is usually shorter, maybe 3 to 6 months. But if the buyer is a hospital system or a private equity group, the transition length could be 1 year to 2 years, sometimes even longer. And by the way, physicians are typically compensated for their time during the transition period. The pay is usually based on local market rates for similar services, and the schedule usually starts at seller's normal hours and then tapers down until they're fully phased out. So to recap, selling a medical practice typically takes about 9 to 12 months from listing to closing, and then another few months to a couple of years of transition assistance, depending on your situation. So if you're thinking of selling a practice in the next few years, start preparing early. It will make the process far less stressful and help you stay in control of the outcome. That's it for this video. Subscribe for more, and thank you for watching.